Hi, and welcome to the Did You Know series here in the month of February. And this month, we're going to be talking about shoulders. Shoulders are pretty cool joints. The biggest thing to know about shoulders are that a lot of things can go wrong because the nature of the joint is that it's a shallow ball and socket. So in a hip, we've got this really deep ball and socket, so the joint is just a lot more stable. In the shoulder, it's a shallow ball and socket. So more work is required of the muscles and ligaments to keep that joint nice and safe without dysfunction happening. So what we're going to talk about today is what do we care about in an evaluation and why do we look into those different areas to have a good understanding of what's going on. So let's do a quick review of the anatomy. So we're going to start with bony anatomy and then we're going to add stuff as we go. So when we think of the shoulder, we've got the long bone here is the humerus, and then we've got over here, we've got the collarbone that comes across, and then we've got the shoulder blade, which comes across. And so that's like a couple of different things going on there that create the shoulder. Now, a lot of people don't realize that in order for the shoulder to move, so for you to raise your arm, the shoulder blade actually has to move as well. So when you raise your arm 60 degrees, which, 90 is way out to the side, so 60 is less. So the minute that you go above 60 degrees, your shoulder blade starts to move as well. And so that's called your scapulohumeral rhythm. So in order for you to have normal shoulder mechanics, you have to have normal mobility of the shoulder blade against the rib cage, and you have to have normal mobility of the shoulder joint itself. So when we're doing an evaluation for the shoulder, we have to look into mid-back, ribs, shoulder blade, as well as the shoulder joint and all of the muscles that are supporting that shoulder in order to really understand what's going on and why. Because if we can figure out why, then we can treat it. So it's important. These are just cool things to know. So now let's start adding in, I'm going to come through here, and let's start adding in some more anatomy so we can learn a little bit more. I'm going to add in connective tissue. So what this is these are the ligaments that help to hold the body together. And what we can see here, which is pretty cool, are the bursa. And so this is kind of key because the bursa are little fluid-filled sacs. And I'm going to zoom in so you can see that these little fluid-filled sacs, there's not a lot of space in here for this little fluid-filled sac, and that's the bursa. So what that does is that's a buffer between bones. And so if that gets pressed on a bunch, it gets inflamed or creates bursitis. So knowing that there's not a lot of space here, it's like, well, what maintains that space? Well, posture helps to maintain that space because you can see here, if this shoulder starts to roll forward, then we're going to get a little bit of a compression that happens. If we can keep that shoulder back, we get more space in between. So we get less, tearing that can happen. The other thing is, let's add some muscles. So we're going to get a little bit more. Ooh, look at that. So see that red that starts coming in here? These are where the rotator cuff tendons come in and start attaching. And so in this little bit of what we call subacromial space, we've got our rotator cuff tendons coming in right along where that bursa sits. And so again, a little bit of dysfunction can create a lot of pain. I'm going to add some more muscle. So now we're starting in with some biceps. And then the cool thing, come through here. So now we can see this bicep tendon coming straight up in the front of the shoulder. So we've got this little bad boy right here. Okay, so this one can get pretty mad as well. That's a common one. And then we've got the pec muscle coming across through here. And so if this pec gets tight and pulls everything forward, it can create a lot of pain in this area. And so looking at the person, it's not a matter of like, where does it hurt? Let me poke it. But let's take a step back and understand, why does that hurt? So understanding, is the mid-back moving? Is the shoulder blade moving? Do we have any sort of tension or compression on the bursa or rotator cuff tendons? Do we just have an imbalance? Like, are you able to use the muscles correctly or not? And so really looking at all of these is how we get that bigger picture of what's going on. Today we're going to talk about the diagnosis of impingement. Impingement means that you just are not able to move your shoulder through a range of motion like you would prefer to be able to do, okay? So why this happens is an imbalance between how you're able to control the position of the humeral head versus the movement in the arm itself versus the movement in the shoulder blade. There's a lot of coordination that has to happen for you to be able to move through range of motion without getting any sort of approximation of bone to bone. Now, we're going to look here and see, we're going to come through and we're going to see how we have the muscles in the back of the shoulder blade. So these muscles control how that shoulder blade moves. So when I raise my arm overhead, that shoulder blade needs to drop and rotate. So if I'm not using these muscles in a correct manner, and the muscles that go down lower, so we've got muscles that are on the top of the shoulder blade, on the bottom of the shoulder blade, and in the middle of the shoulder blade. So a lot of coordination has to happen there. Now, the other thing that has to happen is the rotator cuff muscles back here also need to be able to sequence in time. And then we get to coming around to the muscles in the front of the shoulder. So those muscles can't be so tight that they're pulling that shoulder forward. And then we've got muscles that come up into the neck, boom, up here. So these are the upper traps. So if the upper traps are trying to elevate the shoulder blade versus letting that shoulder blade drop and depress, then that could also be creating why we're not getting the clean movement that we need to get in that shoulder in order to not have pain. So posture and strength plus mobility are all super important. Keeping the pecs stretched out, keeping your mid-back strong without compensation of the upper traps. So if you're working on your mid-back and you're feeling strain in the muscles in your neck, not right. If you're working on your mid-back, what you should feel are the muscles in your mid-back working, not these muscles, but all of these muscles on both sides. So just things to know about trying to be proactive if you do have something hurting, to see if you can try and calm it down a little bit. Today we're going to be talking about, again in the month of shoulders, we're going to talk about the diagnosis of bursitis. Now, the most common bursitis that we'll probably see is the subacromial bursitis. So I'm going to move our little picture here, and let's get the pen. And we're going to draw a picture right through here. So this blue is where the subacromial bursa is sitting. Now, the reason why we care about this bursa is because it commonly can get compressed when we have a postural dysfunction or an imbalance in the tightness in the front of the chest and weakness in the back of the chest. And so as that imbalance happens, then we get this pinched and it gets inflamed. And so a key indicator if bursitis is going on, this is not like 100% foolproof, but in general, if you have something that's called a painful arc of motion, meaning I can raise my arm, for a bit, and then as I get through here, it really hurts, and then it eases off. That is very common with bursitis. So the issue is that as you're raising your arm, you get through that point where it hurts because you're compressing that bursa, and then as you get higher, the compression comes off of the bursa. So how you work on that, well, it depends on why it happened in the first place. One of the most common issues is that there's weakness in the muscles. I'm going to turn around through here. Whoops, let's do this. I'm going to turn this, let's zoom me out a little bit. So we've got weakness in what we call the rotator cuff muscles. So the rotator cuff muscles are these muscles in the back of the shoulder, okay? The other rotator cuff muscle sits on the front of the shoulder blade, and they help to control that humeral head versus the bigger muscles like the deltoids, the biceps, triceps. They're bigger for like actually moving the entire humerus in space or your arm versus controlling the position of the humeral head. So there's two different kind of ways that the muscles work. So if there's an imbalance between the muscles that stabilize the shoulder blade, the muscles that control the rotator cuff, that control the position of the humerus, the tightness that can happen in the front of the chest, and then just the weakness in the mid-back muscles, all of that can culminate into this bursitis type situation. So doing some basic postural exercises of opening up the pecs, making that a really like an effort to make sure that you're keeping those shoulder blades back while you're working, okay, and then just some basic mid-back strengthening can help to decrease these symptoms of bursitis. If it's worse than that and it's not working, seek some physical therapy, see if you can get that to calm back down. But some of the basic things you can try just for improving posture really can help. Tendinitis just means inflammation of a tendon, and there's a lot of different tendons in the shoulder, which is why tendinitis can be a common diagnosis that you hear about. So the tendons that commonly get inflamed are called your rotator cuff tendons, and the rotator cuff are muscles that sit on the back and front of the shoulder blade, and they have tendons, which are what connects the muscle to bone, tendons that attach to your humeral head. And so those muscles help to control what that humeral head does and how it's able to stay coordinated inside of that ball and socket. So rotator cuff tendons could be inflamed. Other ones that could be inflamed are biceps, which are really, really common for those ones as well. So those are probably like the two most common types of tendons that get inflamed. And I've kind of drawn in blue here so you can kind of see a little bit better which ones get inflamed. Now, biceps tendon, if that one's really bothering you, usually you're going to have pain, like if you go to like lift your bag, something where you're bending your elbow, that one can, that'll like, oh, that hurts my shoulder. Or if you have your arm extended and you're loading down on an extended arm out in front of you, you're like, whoa, that kind of kills, that really hurts. That could be a biceps tendinitis. Now, there could be a tear. I'm not saying there's not, but if it is tendinitis, that's usually when it would hurt. Versus rotator cuff, oftentimes, depending on which muscle is involved, you're going to have pain more with overhead reaching. So it's not that painful arc of motion like you get with bursitis. It's going to be more like it just gets worse the higher you go. And if you load it, it hurts really, really a lot. And so that's going to be more common with a rotator cuff tendinitis. And then with that one, if you're lifting something down closer to your body, you're like, that doesn't bother me. It's only when I get into that, when I reach overhead, I'm trying to put my sweater on overhead, that's when those ones can hurt a little bit more. Now, the other type of rotator cuff muscle, which is your subscapularis, now that one is a little bit different. That one might hurt a little bit more with reaching back behind your back, like to pull up pants, reaching behind in your car. If you're like, oh, I tried to reach into my back seat and then I was like, oh, it was really angry and mad at me, then that would be more the subscapularis. Now, again, just like with any other shoulder diagnosis, the reason why this happens is usually some sort of imbalance between tightness in the muscles in the front of the chest, weakness in the rotator cuff, and muscles that help to control that mid-back and normalize the scapulohumeral rhythm, which is how the shoulder moves versus how the shoulder blade moves. And if they're not working together and you start to kind of compress, you can get the tendons that sit underneath here inflamed. So the biggest thing that we're going to talk about today is postural dysfunction, because this is such a common leading cause to shoulders and what can go wrong and what creates pain. So when we think of posture, a number of things we want to talk about, and it's really related to the spine. So what's the position of my spine? Well, in order to really get a nice neutral spine, we have to come all the way to the base of the spine and start at the pelvis, because everything exits off of the pelvis. So if I'm sitting, right, and I start with letting my pelvis tilt backwards, and I go into what we call that slump sit. So this happens in a car, this happens on a soft chair, happens on the couch, like almost anywhere. And I do this. Look what happens to the rest of my back. Automatically, I'm in the more kyphotic posture, which is that mid-back rounds. And then look what happens to my neck. I've got much more what we call increased cervical lordosis, or that curve at the neck. Now, what this does to the shoulder is it rounds the shoulder forward. And what we've been talking about earlier this month is that ball and socket. And so if I don't have adequate space under here where I've got the bursa and tendons all attaching. And if I roll that shoulder forward and I create less space, so it's here versus here, then I'm going to be much more likely to get impingement, bursitis, and tendonitis. So I'm just going to show you a quick example of what happens with my shoulder range of motion when I change the position of my pelvis. So if I'm sitting, okay, I'm going to roll back into that slump sit. Now I'm going to raise my arms as high as I can, okay? I can't go further. Now I'm going to change. I'm going to roll my pelvis forward so I'm sitting up on my sit bones, not back on my tailbone. Now I'm going to raise my arms. So a lot more motion happens just by me changing the position of my pelvis. So some people are like, oh, it's okay, I have lumbar support in my chair. Don't worry, I'm fine. Wrong. Now, lumbar support in the chair puts pressure here. Well, I could still slump. So the key is that you've got to actively make sure that you're sitting up on your tailbones. Then you can drop those shoulder blades down, which opens up the front of the chest, and do your work. So really making sure that the surface that you're on is not tilted back, which happens in a bucket seat in a car, or on a soft surface like a chair that's unsupportive or too overly squishy, or is just too big for you, so you can't sit all the way back in that chair without it hitting the back of your leg. So just make that awareness of tilt the pelvis forward. Everything in life will become easier after that. So stay tuned next month, whole new topic, and continue to learn.